I'm the owner of a Cirrus SR-22, which is a four-seater, very fast airplane. It's completely computerized. I take a lot of trips anywhere east of the Mississippi, either for business or pleasure. I fly my own plane instead of going commercial. I have three children. They were all born and grew up here in Gainesville. My oldest son is a vice president with Barclays Bank in London. My daughter teaches English to French high school students in Paris. And my youngest son is a senior at Dartmouth. Gainesville grows on you. It's a great place to live. The cost of living is very reasonable. The weather is spectacular. Traffic is minimal. People are friendly. And the university provides a spectacular community of like-minded people with whom to associate. And certainly the biggest reason I've stayed here is it's a great place to work. I have lifelong friends that have been here just as long as I have. And they take pride in being part of the UF and Shands healthcare system and in attempting to provide absolutely world-class health care to patients which in the neurosurgery department come from all over the country. The Department of Neurosurgery at the University of Florida is one of the largest neurosurgery departments in the United States. We certainly are in the top 10 for clinical volume, despite the fact that we're located in a very small town. We have 18 full-time faculty. We take 3 residents a year for a 7-year training program, which is the maximum number of residents allowed by the Residency Review Committee. We have several $1 million of extramural research funding and extraordinarily dedicated faculty and staff who are here to help us accomplish our 3 missions: superb clinical care, wonderful education, and research developments to help neurosurgical diseases. Neurosurgeons treat all diseases that affect the brain, the spine, and the peripheral nerves. I primarily do brain surgery, and within the brain area, I concentrate on 2 areas. One is trigeminal neuralgia, which is a very severe facial pain disorder that we can cure with surgery, and the other, and my biggest interest, is brain tumor surgery. So the typical patient with a brain tumor will present in one of 3 ways. The first way relates to the fact that the brain tumor, as it grows, causes increased pressure inside the head. And that pressure will cause headache, nausea, occasionally vomiting, and ultimately decreased consciousness. The second way is the tumor can irritate the normal brain and cause a seizure. A seizure typically will result in loss of consciousness and shaking of the arms or legs for approximately 30 seconds, and then a return to normal. The third way is specific pressure on a specific area of the brain. So if a tumor is growing in the left temporal area, it can cause language difficulty with reading, writing, or speaking. If it grows in the posterior frontal region, it may cause paralysis. If it grows in the occipital area, it could cause visual problems. The typical treatment plan for a patient with a brain tumor really depends on what kind of tumor they have. And we can divide the tumors broadly into 2 groups. One we call metastatic tumors. These are malignant tumors that spread from a primary cancer elsewhere in the body. For example, lung cancer or breast cancer or colon cancer can spread through the bloodstream and wind up in the brain. Those tumors are typically treated either with computer-guided surgical resection, which would typically be a 1-hour operation, 1 night in the hospital and home, or with a special technique that we helped to develop here at the University of Florida called radiosurgery. Radiosurgery is a technique where we focus hundreds of small beams of radiation on a target inside the skull, and we can essentially obliterate the tumor with a highly focused radiation beam. That's an outpatient treatment. The second kind of tumor category is what we call primary brain tumors. Those are tumors that start in the brain themselves. About half of primary brain tumors are malignant, half are benign. Benign tumors may be treated with watchful waiting, with surgical removal, or with radiosurgery, as I mentioned before. Malignant primary brain tumors are typically treated with surgery to remove as much of the tumor as possible and to confirm the diagnosis. And then frequently, surgery is followed with a course of radiation therapy and one of a variety of chemotherapies. Volume is extremely important in medicine, and multiple studies have been published that show that complication rates go up if volume is low. If volume is high and expertise is high, results are much better for patients. Complex brain surgical cases are increasingly referred from community hospital locations to academic medical centers. They require a lot of practice to develop and sustain expertise and good results. And a lot of our referring doctors prefer to send that particular type of case to us while they do a very good job taking care of more routine matters closer to home. I've had the great privilege and pleasure of being trained by wonderful physicians and related specialists. They have certainly inspired me to do my best to not only do a good job taking care of one patient at a time, but to try to use the resource that we have here at an academic medical center, and that is research capability, to develop new methods of treating whole classes of patients at a time. For example, radiosurgery. When we first started working with it, was a completely new method. We had one of the very first radiosurgery machines in the United States and the first in the Southeast. We've treated thousands of patients with that technology, and the machine that was developed here at the University of Florida is in use at hundreds of medical centers around the world. The other rare opportunity that we enjoy here is the opportunity to be educators. So just as I was educated by superb clinicians who were very dedicated, I have the pleasure and privilege of educating wonderfully capable residents in neurological surgery and medical students. I do what I do because I get a profound sense of personal satisfaction from helping people. I enjoy being a UF administrator. I enjoy being an educator. I love being a researcher, but all of that pales in comparison to the magnificent opportunity that I have as a clinical neurosurgeon to work with patients who so desperately need help.